Hello guys and welcome back to my channel. In today's video we'll be going through some NACC PSW practice questions and answers. This is the part 8 video on this series, so if you haven't watched the previous ones you can check the playlist and you'll see a list of all the videos. We'll be starting right off with question 1. To provide visual privacy for clients, you must remember to A. Provide care with the room door open. B. Ask the client's roommate not to look. C. Reach under the covers for cleaning the client's perineal area so as to keep the clients covered at all times. D. Always pull the curtain completely around the person's bed when care is given. Providing visual privacy means ensuring that no one can see the client while care is being provided. So option A, leaving the door open, does not provide privacy. Option B, asking the roommates not to look, is not sufficient or even professional. In option C, keeping the client covered while cleaning is good practice for modesty, but it does not ensure visual privacy from others in the room. The correct answer would be option D, to pull the curtain completely closed in order to ensure that there's complete visual privacy during care. This is the correct and required action. So the best and most standard practice is to pull the privacy curtain completely around the bed and, if possible, close the door. Question 2. Residents have the right to refuse care. True or false? For this, the answer would be true. Residents have the right to refuse care at any time. This is part of their legal and ethical rights to make decisions about their own body and treatment. As a caregiver or support worker, your responsibility is to respect the resident's choice, report the refusal to the nurse or supervisor, and also document the refusal properly. You should never force or pressure a resident to accept care. Question 3. Mr. Bill is being bathed and will return to bed after his bath. What type of bed should you make? A. An occupied bed. B. An open bed. C. A closed bed. D. A surgical bed. An occupied bed means that the bed is made while the person is in it, but this does not apply to the question we have in the scenario. An open bed is prepared for a resident or patient who will return to bed shortly, such as after they've gone for a bath or their treatment. The top linens are folded back in order to make it easy for the person to get into bed. A closed bed is made after a patient is discharged or when the bed will not be used for a while, so the top linens are completely pulled up. A surgical bed is made for a patient that is returning from surgery or procedures on a stretcher. With respect to the scenario we have, since Mr. Bill is returning to bed after his bath, the correct type of bed to make would be an open bed, and that is option B. Question 4. If you broke a vase while providing care in a client's home, you would A. Ask the client how much it costs and give them cash or a check on your account. B. Clean up the broken vase, then excuse yourself immediately and go home. C. Clean up the broken vase, then call your supervisor. D. Attempt to repair the vase and say nothing. Offering personal payment in option A is not appropriate because your agency has procedures for handling damages. In option B, leaving without reporting the incident is unprofessional and should not be done. If you accidentally break something while providing care in a client's home, You should first ensure safety by carefully cleaning up the broken pieces in order to prevent injury, and then report the incident to your supervisor or agency immediately. They will handle the communication with the client and any necessary follow up. In option D, trying to hide or repair the item breaks trusts and violates professional ethics. So the best response is option C. Clean up safely and then report the situation to your supervisor. Question 5. Relying on each other in a group for support is called A. Interdependence, B. Competence, C. Control, D. Dependence. Interdependence means that people rely on and support each other within a team or a group. Each person contributes their strengths while depending on others for help or cooperation when needed. In option B, competence refers to having the skills and ability to do something well. Control in option C means having power or influence over something or someone. Dependence means relying completely on someone else without mutual support. With respect to the statements, the answer would be option A. Interdependence means relying on each other in a group for support. Question 6. Income has no effect on health. True or false? For this, the answer will be false because income does affect health. People with higher income often have better access to healthy food, quality health care, safe housing, and opportunities for physical activities. On the other hand, low income can increase stress and limit access to these resources, which can negatively impact overall health. So, income actually has an effect on health. Question 7. If your client suggests that you make lunch for yourself while preparing hers, the best response would be A. Thank you, but I am fasting for a religious holiday I observe. B. Thank you, I'm starved. I would like to join you. C. Thank you, but I will be fired if I eat your food. D. Thank you, but I have a break later on and I will eat then. In option A, discussing personal religious practices is not necessary in this situation. In option B, accepting the offer is unprofessional. You should not eat the client's food. In option C, mentioning being fired sounds unprofessional and harsh. The best response would be option D because it shows good manners and it also maintains professionalism while avoiding making the client feel uncomfortable. So, option D would be the best response. Let them know that you have a break later on and that you will eat then. Question 8. Mrs. Harvey complains of abdominal discomforts. Watery stool has been leaking from her rectum. This is probably A. Constipation, B. A fecal impaction, C. Anal incontinence, D. Diarrhea. Constipation involves difficulty passing stool and it wouldn't even be watery leakage. So option A does not apply to the scenario we have. When a person has a fecal impaction, the rectum is blocked with hard stool. Liquid stool from higher in the intestines can leak around the impaction, and this may make it look like watery diarrhea. However, fecal impaction requires hard stool blocking the rectum, and this is also not mentioned in the scenario we have. Anal incontinence is the inability to control bowel movements, and this leads to leakage of stool, which can sometimes be watery. This describes what we have in the scenario. In option D, diarrhea refers to frequent loose stools, not necessarily involuntary leakage. So, out of these options, the one that best describes what we have in the scenario is option C, anal incontinence. Question 9. Which vegetable is not allowed on a 1000 mg sodium diet? A. Sauerkraut. B. Lettuce. C. Steamed carrots. D. Steamed broccoli. Sauerkraut is high in sodium because it is salted and pickled, so it is not allowed. So a 1000 mg sodium diet is a low sodium diet, and this is often prescribed for people with high blood pressure, kidney, or heart problems. So sauerkraut is definitely not allowed for them to have this because it is very high in sodium. Lettuce, steamed carrots, and steamed broccoli are naturally low in sodium and they are safe for people with high blood pressure, heart, or kidney problems. So, out of the option, the vegetable that is not allowed on a low sodium diet is option A, sauerkraut. Question 10. People with a disability are at risk for discrimination and stigma. True or false? For this, the answer is true. People with disabilities often face stigma and discrimination in society. This can include negative attitudes or stereotypes, social exclusion or unfair treatment, barriers to education, employment, and healthcare. Respecting their rights and promoting inclusion is essential in order to reduce these risks. Question 11. When a client is proposed a treatment and they are informed of what it is, why it's being done, who will do it, how it will be done, the risks, alternative options, and expected outcome, it is referring to what act? A. Substitute Decisions Act. B. Right to Choice. C. Consent to Treatment Act. D. Self-Determination Act. The Substitute Decisions Act covers decisions that are made on behalf of someone who cannot make those decisions themselves. The right to choice in option B is a general principle. It is not a specific law. The Consent to Treatment Act ensures that a client is fully informed about a proposed treatment, including what it is, why it is being done, who will do it, how it will be done, the risks, alternatives, and expected outcomes. Now, that client has the right to accept or refuse the treatment. The Self-Determination Act refers to a person's general right to make decisions, but it is not the detailed consent process. So our answer here is option C. The Consent to Treatment Act is what is being referred to in the question. Question 12. When you first meet a new client, you must get to know him or her. Which of the following choices would help you establish rapport? A. Read care plan. B. Talk about clients' desires, needs, and routines. C. Ask open-ended questions and listen. D. All of the above. For this, we'll begin with option D. Establishing rapport with a new client involves multiple steps like reading the care plan. By doing this, it will help you to understand the client's needs, preferences, and routines. Also, talk about the client's desires, their routines, and their needs. This shows that you have interest in the client as a person, and also asking open-ended questions and listening. This encourages the clients to share information and also build trust. Question 13. Respecting and guarding personal and private information refers to A. Rational detachment. B. Confidentiality. C. Ethics. D. Jurisprudence. Rational detachment means staying emotionally neutral in professional situations. Confidentiality, on the other hand, means protecting a person's private information and only sharing it with authorized individuals when necessary for care. Ethics refers to principles of right and wrong behavior, while jurisprudence refers to the study or system of law. Based on the question we have, the correct answer is confidentiality. It means respecting and guarding personal and private information about a person. Question 14. Define the role of the PSW on a healthcare team. A. Assist the team by following the existing care plan. B. Provide required assistance safely and competently. C. Report and record care and observations. D. All of the above. For this as well, we'll be going with all of the above. So, the personal support worker plays an important role on the healthcare team, and this includes assisting the team by following the existing care plan to ensure continuity of care for the clients, providing required assistance safely and competently, which supports the client's daily needs while maintaining safety, and finally, reporting and recording care and observations. This communicates important information to the team for proper care decisions. So, together, these responsibilities reflect the full role of a PSW on a healthcare team. Question 15. Disability and illness often affect sexual function. True or false? For this, the answer is true. Disability and illness can impact sexual function in various ways, including physical limitations like mobility, energy, and sensory changes, hormonal or neurological changes. It could be also as a result of medication side effects, and also emotional or psychological factors such as stress, depression, or anxiety. Healthcare providers and caregivers should respect privacy, provide support, and offer appropriate information when needed to the clients. Question 16. When is proper body alignment necessary? A. When standing. B. When sitting. C. When lying down. D. All the time. For this, we will be going with option D. Proper body alignment is important in every position, whether you're standing, sitting, or lying down, because it reduces strain on muscles and joints. It also prevents pressure sores and injury. It promotes good circulation and breathing, and it also helps to maintain balance and mobility. Question 17. How does the Consent to Treatment Act affect the PSW? A. A PSW must ask the client for consent before touching them for any reason. B. A PSW must ask for written consent before giving a bed bath to a client. C. A PSW must ask the nurse for permission before touching the client. D. The doctor must give consent for the client to have care completed. Now, under the Consent to Treatment Act, every client has the right to give or refuse consent for care. For a PSW, consent does not always have to be written for routine care like bathing, feeding, or assisting with mobility. The PSW, however, must always ask the client's permission before providing care or even touching them. Written consent is usually required for medical procedures, but not for daily personal care. So, based on these options, the one that affects the PSW is option A. Before touching the client, the PSW must ask for consent. Respecting consent ensures client autonomy and legal protection for both the client and the PSW. Question 18. Identify two different examples of harassment a PSW can be exposed to at work. A. Being exposed to inappropriate sexual gestures by a client or other staff member. B. Verbal or physical abuse by a staff member to another staff member, such as being yelled at or pushed. C. Being appropriately complimented by a staff member or client. D. Both options A and B. Harassment in the workplace includes behaviors that are offensive, unwanted, or intimidating. If we look at the options we have, option A, inappropriate sexual gestures or comments from a client or coworker is harassment. Additionally, option B, verbal or physical abuse is also harassment. Option C is not harassment because the PSW is being appropriately complimented by a staff member, so that is not harassment. Out of the option, the ones that are tagged as harassment are options A and B. Question 19. What should the PSW do in the situations described in the previous question? We previously answered the question about harassment. So this next question is asking what should the PSW do in the situation described? A. Keep quiet and don't tell anyone as you don't want to start a problem. B. Tell a coworker and see what they think. C. Ask the person to stop and report to your supervisor immediately. D. Tell a friend or family member. When a PSW experiences harassment at work, the proper steps are 1. Set boundaries. Ask the person to stop the inappropriate behavior, no matter who the person is. Secondly, report immediately. So, inform your supervisor or manager so that the situation can be addressed according to workplace policies. Every workplace has policies that protect the employee. So, you have to report this so that it can be handled appropriately. In option A, keeping quiet is unsafe and unprofessional, and the harassment will continue. In option B, asking a coworker will not formally address the issue. So the best thing to do is option C. Ask the person to stop. That is where you set the boundaries and then report to your supervisor immediately. In option D, telling a friend or family member does not trigger workplace action. So the best option is option C. Ask the person to stop and then report to your supervisor or manager immediately. Question 20. Miss Sharma states she has pain. What do you do first? A. Tell her she looks good to preserve her self-esteem. B. Call the nurse. C. Ask about pain's location, duration, intensity, and other options. D. State you have Tylenol and will share some with her. Option A ignores her pain. Telling her she looks good does not address the pain she's complaining about. In option B, calling the nurse immediately is important, but first you have to provide accurate information by assessing the pain. So when a client reports pain, the first step to take is to assess the pain by gathering information about the location. So you ask Ms. Sharma, where does it hurt? The duration, that is how long has the pain lasted? Intensity, so you can use a scale of 1 to 10 to know how severe the pain is. And then ask if there are other symptoms, like are there any additional signs or changes? This will help the nurse or the healthcare team to make informed decisions about Ms. Sharma's care. In option D, giving medication is not allowed. PSWs cannot administer medications independently. So the key point is always assess the pain first before reporting, or acting. So that will be option C. Question 21. Which one of the following is a breach of respecting privacy legislation? A. Phone the next client from the present client's home. B. Losing your day timer. C. Discussing client information with his or her family. D. All of the above. Breaches of privacy legislation occurs whenever client information is accessed inappropriately or disclosed. This can include actions like phoning the next client from your present client's home because you may inadvertently reveal personal information. Also, if you lose your day timer, it can cause a breach of privacy because if it contains client names or details, it is a confidentiality risk. Thirdly, sharing private information without consent with the client's family is a breach, so it should not be done at all. Out of the options, options A, B, and C are a breach of privacy legislation. So the answer here would be option D. The answer here would be option D. Question 22. Which is Trendelenburg position? A. Semi-sitting, head of bed elevated degrees. B. Head of bed is raised and foot of bed is lowered. C. Head of bed is lowered and foot of bed is raised. D. Flat position. In option A, the semi-sitting position where the head of the bed is elevated about 30 to 45 degrees, that is known as the Fowler's position. In option B, where the head is up and the foot is down, that is the reverse Trendelenburg position. The Trendelenburg position involves lowering the head of the bed and raising the foot of the bed. This is used to facilitate some surgical procedures as well as improving blood flow to the brain in cases of shock. Flat position is where the bed is completely horizontal, but the Trendelenburg position is option C, where the head of the bed is lowered and the foot of the bed is raised. So just remember, Trendelenburg is head down, feet up. Question 23. Nail care cannot be done on A. Clients who have diabetes. B. Clients with poor circulation. C. Clients on blood thinners. D. All of the above. Nail care must be done with caution or avoided in clients who are at risk of injury or infection. This includes clients with diabetes or the ones that have poor circulation. With diabetes, they have a higher risk of infection and poor healing. Clients with poor circulation, if they have cuts or injuries, it may heal slowly and lead to complications. Also, clients on blood thinners are at a higher risk of bleeding even from minor cuts. So for this type of clients, nail care should only be done by a healthcare professional, not a PSW. So out of these options, we'll begin with all of the above. Nail care cannot be done on clients with diabetes, clients with poor circulation, or clients on blood thinners. Question 24. Which one of the following would be a violation of a client's autonomy? A. Ensuring that your client knows your name and professional title. B. Notifying your supervisor when your client asks for further information regarding the client's diagnosis. C. Opening and reading your client's mail to provide you with further information. D. Allowing your client to make choices. In option A, introducing yourself maintains transparency and trust and does not violate autonomy. In option B, notifying your supervisor for information is appropriate and also does not violate autonomy. In option C, reading a client's mail without permission is a clear violation of privacy and autonomy. This should never be done by a support worker. In option D, allowing the client to make safe choices supports their autonomy. Remember, autonomy is a client's right to make decisions about their own life and personal information. Violating that means disregarding their privacy or control over their personal matters. So, our answer here is option C. Question 25. You are working within a family home, caring for the 45-year-old mother who is recovering from surgery. One day, the woman expresses to you her anger that her daughter, age 18, is living with her boyfriend. Using a scenario to answer the question. Now, the question: when the mother complains to you, your response should reflect all of the following except A, understanding of age differences, B, unbiased views, C, your feelings of what is morally acceptable, D, good communication skill. Now, as a caregiver, your response to this kind of situation should be professional, empathetic, and non judgmental. You should demonstrate an understanding of the age differences. So, recognizing that different generations may have different values. Secondly, do not judge or provide your personal opinion about the situation. And then you can listen actively and respond respectfully. Out of these options, what you shouldn't do is expressing your feeling of what is morally acceptable. This is not appropriate because it may influence or upset the client and even compromise professional boundaries. So you shouldn't be doing that. This brings us to the end of the video. Don't forget to like, comment, and share. And also hit the subscribe button so that you'll be informed when our next video will be dropping. Thank you for watching, and I'll see you in the next one.